Hey, welcome to the Gwinnett Small Business Spotlight. We love to feature and celebrate the small businesses within our county through quick interviews. You learn who they are, what they do, why they do it, why you should use them, and where you can find them. And I encourage you to seek out these businesses and support these men and women who help make Gwinnett County great. And today's guest is Dr. Chris Connelly. He is the founder and chief education officer for a company called Braincussion. Hey, Dr. Connelly, thanks for visiting with us today.
Thank you for having me.
Yeah, you are an amazing doctor. My clients have used you for years. I know the insurance companies use you as an expert. You're respected not only in Gwinnett County, but throughout Georgia, throughout the Southeast. Please tell our viewers a little bit about you today.
Well, thank you, Gary. Well, I've been in practice for almost 25 years. We've treated thousands of patients with motor vehicle collisions, sports injuries, work injuries, things of that nature. And about 5 or 6 years ago, I recognized the need for evaluation of brain injuries. So I worked with a company called Brainscope and the American Brain Institute of America and other organizations like the VA and the CDC to get certified in identification of brain injuries. And over that time, I realized a lot of these patients we were seeing actually had brain injury, they had spinal injury as well, but mostly the brain injury were the recurring symptoms. And so we took other extra steps to develop best practices and things to help get patients better. So we're getting phenomenal results, but we found early identification for these brain injuries is one of the best things to give these patients a likelihood of the best chance to get better.
So all that experience led you to start the company Braincussion. I love the name, by the way. That's awesome. And a concussion is a nice way of saying a traumatic brain injury, correct?
It is. So a traumatic brain injury could be a bump, a jolt. It could be some type of abnormality to the brain. Even like in the military, it could be a blow to the brain that actually winds up causing a dysfunction within the brain. And there's many different physiological reasons why the brain develops an injury. And with that injury, then they have symptoms because of the brain injury.
And tell us a little bit more, if you would, about the symptoms. What are some of the typical symptoms someone may experience, say, after a car wreck?
Well, first of all, we classify the patient based on mild, moderate, or severe brain injury. And again, it's only mild if it's not your brain. When it's your brain, it's really serious. So for a lot of patients, when they come in, the primary symptom is, I just don't feel like myself. And they feel foggy. They feel confused. They're scared. They have anxiety, and they have a lot of other issues. But they also may have loss of consciousness, headaches, confusion, dizziness, ringing in the ears, problems with neck pain as well, sleep problems. So there's a whole host of problems. In fact, many experts have identified over 100 different symptoms that could originate from the brain.
Wow. Now, are there some symptoms that could present later?
They can. So memory loss, continued neurodegeneration. And so we have the acute stage, which is within about, say, 4 to 6 weeks after the trauma. Then you have subacute that could last up to about 12 weeks or a couple months. And then we have persistent or chronic symptoms. So there's a couple of different things that happen depending on the tissue damage. And one thing to point out is even though the symptoms may subside or go away, study after study is now showing the process of the chronic degenerative process in the brain, like we're seeing with the football players and different sports teams, that chronic degenerative process is the thing that we have to be concerned about most long term.
Now, I know a lot of attorneys are going to be watching this video because of the traumatic brain injury component. Are there things lawyers should be looking for that represent clients in a car wreck that may indicate the person, the driver, the occupant sustained a traumatic brain injury?
Sure. So airbag deployment, severe collision, anytime if the head does hit anything, but the head doesn't have to hit anything. But the clients that may just seem off, where they may even be missing appointments, missing calls, not themselves, crying, if they're really distraught, family issues, if they just can't even fill out forms. So sometimes they may say, well, they're just, having a certain problem, but in reality, it's a brain injury. So we even see patients in the clinic where they say, I can't fill out the forms. And what happens is those brain injuries wind up having multiple factors. So if a client, if you're dealing with them and if they can't even do the form, that's a sign it could be a brain injury.
And Dr. Connelly, I know that there are other signs or symptoms that you may see within the clinic besides them having difficulty filling out a form. What are some of those other symptoms?
Sure. So sometimes they may throw up. We've actually
Wow.
had them sit here, they feel nauseous, and they throw up. We've had problems where they weren't even able to make it to the back. And we actually use one of the front exam rooms because they can't even walk to the back. We also have problems where sometimes they can't even come to the office, so we have to do telemed services. And one of the things with Braincussion is we found that, a lot of these patients or clients that they don't have access to proper medical treatment. We actually had a patient the other day who had some traumatic experiences where, unfortunately, his son was lost in the military, and it just brought up a lot of emotional things. So, we have to look at the tissue damage, but there's always an emotional component as well. So it's important to triage for TBI, but also PTSD as well.
Now, I know we only have one brain, obviously, but with a TBI, just how big is the problem? Should someone be concerned if they themselves have been in a wreck and sustained a TBI, or their loved one sustained one?
Well, if you look at the data, the CDC calls it a silent epidemic. Unfortunately, the military and the CDC have done a lot of research in this, and it's a serious problem, and it's underdiagnosed. In fact, one study that was done in the ER found that 56% of people who later get diagnosed with a concussion are missed at the ER with the entry-level diagnosis of a concussion. So it is difficult because that entry diagnosis is so important to make sure they could reduce the symptoms as quickly as possible.
And tell us more. We were talking off camera about the VA study. Tell us more about that and why that should have all kinds of bells and whistles going off for us if we or our loved ones sustained a TBI.
Well, and with a TBI, there's moderate, mild, and severe. They classify them based on different standards. And this was a study done in the American Medical Association Journal of 350,000 military personnel that had mild traumatic brain injuries. So they had no bleeds. And they found that of the 350,000 veterans, they had a 2 times increased risk of dementia as they get older. And that shows that a brain injury, although the symptoms may reduce or even resolve, that the neurodegenerative process can go on for the remainder of the person's life. So the more accurately we help with healing of the brain and also avoiding factors that can cause potential worsening of symptoms like a repeat head injury, the better prognosis the patient has going forward. Because when it's your brain, it's serious. And so we see a lot of patients as well that they catastrophize, and it's really dramatic.
So obviously there's a big problem out there, and we need to do a better job, not only within the legal community, but the medical community, on diagnosing and assessing TBIs and developing early treatment protocols. When we come back, I'd love for you to talk more about how the medical community is currently dealing with TBIs, why that needs to change, and what Braincussion is doing to resolve the problem. Okay? All right. Thanks, Dr. Connelly.
Thank you.